5 leave out subparagraphs 4 and 5.
My Lords, I've got my name down to support the amendment in the name of the Noble Lord Udny Lister, and in terms of 161, and also I'm interested in the themes in Amendment 173A, which we've just heard from Lord Howard of Rising, because I do think an assessment and research into the impact of any kind of advertising and sponsorship restrictions is very important moving forward. The reason why I'm concerned about any advertising restrictions is that people who currently smoke and are looking to switch to vape can only do so if they know what vapes are and understand the facts around relative harms and where these products can be purchased and so on. Imposing these restrictions as written in the bill without consultation would have grave unintended consequences. At the very least, there must be clearly defined exemptions. My Lords, in this House, there's constantly talk about the problem of misinformation, and it's one that I share. We don't want people to be making judgments about anything based on misinformed or factual inaccuracy. And yet, the difference between vaping and smoking is not well understood. Public Health England, and indeed Dr. Khan's independent review, concluded that vapes are 95% less harmful than tobacco. Yet misperceptions about the harm of vaping have risen at the same time. So 56% of adults in 2025 believe that vaping is more or equally harmful compared to cigarettes. And that's compared with a third, 33%, in 2022. In other words, misinformation is creating misperceptions ever more every year. Optimum research from July 2025 found that 51% of all respondents believe vapes are equally or more harmful than smoking, and 48% of current smokers believe that. And certainly they don't know that vapes and other nicotine products have 99% less toxicants than cigarettes. So curtailing the opportunity to provide public information on the relative benefits of vaping, as this bill threatens to do, would further exacerbate this lack of understanding. My concern is that a lot of the discussion is driven by a small but very loud portion of lobbyists who are very concerned about youth vaping rates, and lobbying groups have particularly pushed that, as has the public health industry. But actually, the percentage of young people who vape is dwarfed by adult vapers, many of whom, as we've heard, have switched to vaping from smoking for health reasons. Now that safer alternative could be in jeopardy unless we make it clear and allow, and therefore advertising to make it clear, that vaping is in fact a desirable, healthy option. By putting forward the argument that vaping is actually not desirable, just as dangerous as smoking, then we actually risk doing public health a real disservice. Vaping products, even now, are only being allowed very restricted advertising since the tobacco and related products regulations came into force in May 2016. Clauses in the bill, additional to these restrictions, go so far, I fear, to treat vaping products as though they are the same as tobacco products. And that sends a message, an implicit message, that nicotine, vaping, tobacco, smoking cigarettes and vaping are all much of a muchness. And I do think that that's one of the themes that I've been pursuing in this group, so that we need to have a much more granular, nuanced approach. Prohibiting any form of marketing for vape or nicotine product manufacturers directly undermines the important role, therefore, that marketing has to play in encouraging smokers to switch to vaping or other nicotine products. And just to finish off, there just seems to be a complete contradiction. On the NHS Better Health webpage, it says in big letters, vaping to quit smoking. And I want to know, isn't that advertising? It contains a range of information and advice to people who smoke and are looking to quit. And in fact, I read it when I was smoking and looking to quit. It includes the message, you are roughly twice as likely to quit smoking if you use a nicotine vape compared with other nicotine replacement products like patches or gum. That's what the NHS say. And I just want to ensure that adult smokers like myself have access to information, because when I read that, I then had to go out and find out about vapes. I went, in fact, to the local vape shop and had a bit of a seminar. I then went to the local convenience store and talked to them, and I looked at the range of vapes. And then, as a consequence, I took up vaping and eventually gave up smoking, which I would have thought the government would want. But if I hadn't been able to see where those vapes were on sale, see the advertising and the marketing, read it, then I might have stayed as a smoker. And it's not about me, but it is about all the other smokers who as yet do not understand that vaping is a safer option than smoking. And they might as well find out about it. And I would have hoped that the government would be encouraging them, not discouraging them.